The pathway to becoming a cardiologist is full of twists and turns and requires trainees to stay fully focused. That said, so does becoming a parent. As a new mom myself, I wanted to know more about the journey cardiology trainees take when simultaneously starting a family, how they are changed as physicians, and how they would like to see the medical community support them. This is Fellows Forum. Thank you all so much for joining me today to talk about this important topic. I'd love it if we can get started thinking back over your journey to becoming both a parent and a cardiologist over the past year, a couple of years. What moment or moments particularly stick out to you? And Dr. Yang, let's start with you.
Oh, thanks so much, Yale, for having me. I think I totally agree that this is a really important topic to talk about, and I think that we don't talk about it enough. So just a little bit of intro. My name is Wendy Yang. I just finished my general cardiology fellowship at Hopkins. I actually had my son almost 3 years ago now when I was during my research year. And I know that everyone can't sort of time it perfectly, but I would say having a child during research year definitely was helpful, that I wasn't sort of in the midst of, a heavy clinical workload. But I would say, there's a lot of challenges. And I think now that my son is 3, sort of each stage in his life was challenging in different ways. I think in particular, a couple of highlights, when he was particularly young as an infant. I actually transitioned back to my clinical year before he turned 1, and making sure that that transition worked. I think, in terms of just giving a little bit of advice, planning ahead and giving yourself more room than you think you need is very helpful. But I think some of the things that stuck out were just, having a good support system. And that would look different, I think, to everyone, whether you have family or not, whether you have, neighborhood community to help. But I think it was very important for me to have a fellowship support system. And what that looked like was basically my chief fellow and my program director were helpful in helping me make that transition when I went back to clinical work, and giving me rotations that were predictable during the times that I needed it. Other notable highlights, particularly in this past year, was of course COVID. That can't go unmentioned, and of course the challenges that go with childcare in the midst of a pandemic.
Yeah, definitely. I think we can all relate to the challenges of the last year. Dr. Kumar, I know you have a very fresh little baby at home. I'd love if you could talk about some of the moments that have stood out to you over the past couple of months, and have there been any challenges for you?
Yeah, well, thanks, Yale, for organizing this. Well, my name is Arnav, and I just completed my general cardiology fellowship at Emory in Atlanta. And since July, I started my interventional fellowship at Brigham and Women Hospital in Boston. As Yale mentioned, I have a 8-week-old, and like it was mentioned, it's difficult to time these things. Well, having a young baby is such a great joy in life, but it's a little challenging if the household has 2 doctors, if both parents are both in the medical field. In my case, my wife's pregnancy was a little complicated one, but I have to thank my program director, Dr. Robbie Williams, who was very supportive. And there were some time when there was an urgent situation, I had to rush to take my wife to the ER or to the OB, and he was always there by text or call, and he arranged for coverage so I can take care of my family. So in the end, as the pregnancy progressed, my wife ended up requiring an emergency C-section. And so the baby, who is now 8 weeks old, was born in June. Well, the challenge was that I had to start a new fellowship in a new city, in a new system in Boston. And because my wife just had a C-section and my baby was so young, they could not have moved. So I contacted my program directors here at Brigham, Dr. Ajar Kochar and Dr. Pinak Shah, and they actually helped me and they worked with me in a way that I could take some time off in August, which is now. And this past weekend, I went back to Atlanta and I drove with them to Boston over 3 days. And I also got a few free days after to help them settle in Boston. One other thing, I would echo the same thing that was mentioned before, to have an open communication with your program leadership. The moment I knew that I was going to have a baby and it will be a complicated pregnancy, I was almost over communicating that, hey, this is what's happening. I think that helped everybody. I was also lucky to count on family support, and both my parents and my wife's parents took turns in helping us through the pregnancy and taking care of the baby after the baby was born. One of the challenges that I did want to mention is actually a financial one, which I think in medical field, it's not often mentioned. Due to my wife having a high-risk pregnancy and then undergoing a C-section, my wife, who is an endocrinologist, could not work for a few months. The issue that we faced is that most new employers require a year of employment for paid maternity leave. And this definitely can become a challenge if you are having a baby and you're transitioning to a new hospital system or new city at the same time.
Those are definitely some real challenges that I'm sure a lot of people are facing. And we've definitely heard some great things about how your programs have supported you so far. So Dr. Minga, I'd love to know, how was your program? Did you feel supported by your program as you kind of went through this transition? And I'd love to know about the kind of leave you were able to take, and if you felt like that was really able to help you in this journey.
Right. I felt 100% supported. Same with me. I had a pretty complicated pregnancy that I found out I was pregnant literally first month of fellowship, and I was doing during my clinical rotations, and the pregnancy was also, for me, was very complicated. And then when I disclosed it to my program director and the program coordinator especially, they were 100% had my back. At one point during pregnancy, I had to be pretty much monitored every week or every other week. So that meant taking time away off my clinicals, and they were able to really fit that in my schedule. I was able to take a full 3 months off. And the way I did that was 1 month was research, and then the other 2 months was I was able to accumulate all my leave or all my vacations in 1 month, and then I had the right to take another 20 days for my program, just for maternity leave. So I was 100% supported, 100% backed up from my program director, my program coordinator, Karen, and then all the fellows that were able to, switch call with me and kind of be there for me when I was going through a difficult pregnancy and then during maternity leave.
That's amazing that you were able to take so much time. I've heard some stories of a lot of physicians having to go back after only like 6 or 7 weeks. So that's really great. Dr. Ying, what kind of leave were you able to take, and did you feel kind of supported in that transition?
I did, yeah. So specifically regarding my leave, I also was able to take almost 3 months. And, I think, again, because I had my child during my research year, I actually, my leave was, I actually decided to take a little bit less than 3 months of formal leave, because I had the luxury of when I eased back in, it wasn't quite so, quite so abrupt. I did want to echo, what Dr. Kumar mentioned in terms of the fact that it can be difficult for dual physician couples, and in terms of, discussing this with your program and communicating a lot. My husband is actually a surgeon, and so we tried our best to make it so that we kind of alternated busy rotation, so that, you know, when I was on a busy rotation, he was on a light one, but we just didn't, because our schedules are almost, you know, at least his schedule was almost all busy rotations. There were a lot of months when both of us were on busy rotations, and we had a lot of family help to get us through it, but also a lot of program support during the times when, you know, I had to be on a lighter rotation. So I think both in terms of that as well as leave, you know, I think it's important just to communicate it to your program. Hopefully you're at a place that is supportive, but I think regardless, a lot of communication is helpful to get you the amount of leave that you need. I would say just coming out, you know, just give yourself more time than you think you need. It's always going to be unexpected things come up, unpredictable things come up. We've heard a lot about high-risk pregnancies, and, you know, things come up. So if you can sort of give yourself the maximum amount of leave that your program would allow, I think that would be really helpful.
Definitely kind of cushion that transition back, because your world is just rocked, you know, by this new little being in your life. I could totally relate to that. So I'd love to know, Dr. Minga, if you could think back, what resource or even resources do you wish you might have had that would have helped even more ease the transition of you becoming a new parent, but also becoming a cardiologist?
I think it's probably, you know, a community of, I mean, for me specifically, of female cardiologists, because I think the challenges that we face are a little bit different. For me, for example, a lot of anxiety was related with radiation exposure, because you had to do rotations like electrophysiology or catheterizations or cath lab, that there is a significant amount of radiation exposure. So I think would have been definitely much more calming if I had a support or a platform like what we're creating here today, to kind of hear from other people's experiences of how they dealt with, you know, with high-risk pregnancy, how they dealt with maternity leave, how they dealt with anxiety that comes, for example, with things like radiation exposure or different things that when it comes to child care. So I think that would have been definitely beneficial, having role models or people who have gone through the same experience to kind of learn from. And it can be challenging when you're kind of like the first or the only person that you think, you know, after I delivered my baby, then I understood that a lot of my female attendings, which are much older than me, they had gone through the same experience. And I wish that was there for me maybe a little bit before, to kind of talk to them and open up to them and see what their experience was like.
Yeah, that's definitely something that seems very important. It's like you only realize you needed that help after the fact.
Exactly.
Yeah. Dr. Kumar, are there any resources you wish you either had right now or that you had, you know, a couple months ago, getting into this phase of your life?
You know, it's interesting because of what Eva just mentioned. And I remember that there is a faculty whose name is Özlem Bilen, and she was a fellow, and she is now a faculty at Emory. And because this is our first baby, and obviously there was anxiety, and so I would just ask her like everything, like, you know, what should we do now? What should we do next? I mean, she advised us from baby diapers to managing finances and everything. And I think for fellows, it is very important to identify someone like that who's you're more like a friend to you, but also has the experience to guide you both through the clinical training and as well as from the parents' perspective. Honestly, for me, I had a lot of family support, which I think really helped us. And I think if it was just the two of us, we would have probably needed a lot more time off. But the fact that I had some family there, like when I was, you know, I was scrubbing into cath lab, of course, I can't pick up my phone, but just the fact that I knew that somebody was there from my family who would take care of my wife if needed, gave me a lot of peace. So I think in terms of resources, I think asking for help is just so important in this case when both parents are in the medical field.
Definitely. And Dr. Ying, I wonder, you being a couple years out now from having your child, do you see yourself going up to newer parents or even just being asked, how did you do this? Is that something that a position you've been in?
Yeah, absolutely. I definitely echo everything that's been said so far about, um, reaching out and forming a community. I think, kind of like Eva mentioned, sometimes after you have a child, it can be a little bit isolating. You feel like you've just gone through this tremendous experience, and now you're at home with your newborn, and all these questions come up if you're a first, especially if you're a first-time parent. Because this is something that we've trained all these years in medicine, but we haven't, at least if you're a first-time parent, had to go through this process of taking care of your own child before. I remember having a lot of questions, and if it was something that I had to search for hours online for, and if I didn't know who to call, it was pretty anxiety provoking and honestly quite stressful. So I think what helped me was sort of anticipating that I might need some help, and so before I delivered, seeking out these Facebook groups and asking my peers for communities, even while I was pregnant, anticipating that I might have a lot of questions after the baby was born or just during the process. And then afterward, just being not shy about going up to especially junior faculty who have recently gone through this process for advice and tips. And then honestly, just, hand me down baby supplies.
Hand-me-downs are definitely the best. Dr. Minga, can you, looking back, do you think that becoming a parent has changed the way that you approach your practice of medicine at all?
I think it has allowed me to become connected with patients and with attendings and peers in a way that maybe I was never able to connect before. It's always a point of conversation with my patients, and actually it's funny because they teach me more than I'm able to teach them. So it's actually quite a bonding experience, I think. And I think overall it just made me a little bit more efficient. Juggling fellowship and studying for boards and taking care of a new baby, you have to become more efficient, and has allowed me to function in less sleep and more coffee and overall.
Less sleep, more coffee. I should make that a t-shirt. Dr. Yang, what about you? Has your practice of medicine changed since you became a parent?
Yeah, I think it's definitely allowed me to see sort of the things that are important. I think what actually was pretty profound and kind of a revelation for me was the fact that not specifically my practice of medicine, but how I viewed my career. Because I think having a baby and just having so much less time on your hands was for me a really good barometer and kind of a test for what things and what projects are important to me, what things I'm interested in, and what things will actually advance my career. So the way that sort of my mentality changed after I had a baby was that I started pursuing things that were most useful to me and most interesting to me. And I think that kind of shifted the way that I approach either academic projects or clinical work. And then also, I just went through my job search, and it also was able to help me hone in on what I think I want to do for my career and sort of present myself in a more unified way when I went on my job interviews, because it kind of forced me to prioritize and ask myself what I really wanted to do. So I think for me, that kind of was a little bit of a change in my mentality, and that was definitely helpful in knowing that I had to prioritize and I had to pick the things that were most important to me, and this is what I'm going to look for in my future career.
That's so great to hear. And Dr. Kumar, I know it's only been 8 weeks, but has your perspective changed at all on the kind of doctor that you are?
I think it has, and I would like to echo everything that was said about making yourself more efficient, picking up the right projects, and sort of keeping the other things which might be important. But right now I have an 8-week-old, so I definitely have kept some other projects on the back burner. But overall, I think my practice of medicine has become more comprehensive in a way. because just, with my wife's high-risk pregnancy, I got a new perspective on how to feel as a patient and a family member. I do feel that I put myself in my patient's shoes more often and sort of have a comprehensive understanding of what they're coming with. And that does not limit just to their respective ailments, but what are their psychosocial needs, what are the various challenges that they face. So definitely having gone through this pregnancy and having an 8-week-old has changed my perspective a lot. I would like to say that I do not want to miss any minute of him growing up. And that definitely has made me more efficient. And I try to be efficient and come back home and try to see if I can, be part of all his milestones growing up.
So to sum it up, I'd love one sentence each. What's your best advice to a trainee who is seeking to become or soon to become a parent at this point in their life? Dr. Yang, let's start with you.
It's tough to boil it down to one sentence. I would say one thing I realized was just be kind to yourself. The practice of medicine is difficult, and this is the time in your life that you're trying to cultivate the kind of doctor that you want to become. As well, at the same time, you're trying to cultivate the kind of parent that you're trying to become. And it's impossible to be perfect. And one thing that I realized was, children, they grow up fine. And, you don't have to be perfect in any way. Just be kind to yourself. And again, be efficient and prioritize those things that are truly important. And if you take care of those important things, then the rest will just fall into place.
That's excellent advice. Dr. Kumar, what about you?
Yeah, I would like to mention that what helped with my situation was getting family help, but also identifying people in your program who have gone through something similar and talk to them about what to expect, help about baby, help about delivery, and many things. Just by chatting, you might know about some financial program which can help you support during your transition period. So I think open line of communication in your program is very important.
Great. And Dr. Minga, what's your advice?
And my advice would be not to be afraid to ask for help. Definitely, I don't think I could have done, going through the pregnancy that I had without the help of my program, specifically Dr. Persani and the coordinator, and the help of my co-fellows. And especially now, I will not be able to, to work and be able to juggle everything without the help of my family, who's taking care of my baby. So, pregnancy is unpredictable in many ways. Having kids is unpredictable in many ways. They get sick when you don't expect it, and something might happen when you don't expect it. And I think it's okay if you say that I need some help and I need some backup today.
This has been such a great conversation, and I'm sure it's going to resonate with so many. Thank you all so much for having the time here to speak with me today.
Thank you.
Thank you.
Thank you for inviting.